Welcome, Abby.
Hey.
My name's Teresa. I'm going to
Nice
have you
to meet you.
sit right here on the exam table.
Okay.
And if you would, just tell me why you're here today.
I've just come because I have a little cough. I'd
Okay.
like to get it looked at.
And when did that begin?
3 days ago.
Okay. And are you coughing anything up?
Not as much anymore, but I was coughing up a lot of thick mucusy messes.
Okay. What color was it?
It was yellow, but now it's clear and thinner.
Okay. Were you taking anything to help alleviate your cough?
I took one Mucinex, but I wasn't a fan because I didn't get any sleep that night because I was spitting every 3 minutes.
Do you have a history of any respiratory diseases or issues?
No, ma'am.
Any family history?
No.
Okay. Do you experience any shortness of breath or chest pain throughout the day or when you wake up?
No, I really never had much.
Okay, good. Any problems with your veins or abnormalities with your lungs or heart that you would like to talk about? Okay. Any surgical history?
Yeah.
Alright, well before we begin my exam, I'm going to use my hand sanitizer. I'm just going to take a look at your thoracic, your rib cage, which it looks normal, symmetrical, and your ribs slope downward, which is normal. And to begin, I'm going to go ahead and place my hands on your rib cage. I'm going to have you take a deep breath, okay? Good. Now we'll do that same thing on the back. Very good. And my thumbs raised symmetrically, which is normal, okay? And now I'm going to move my hand across your chest on the front and back, and I'm going to have you say 99. I'm just listening for, or feeling the same sound in all the areas, okay?
99, 99, 99, 99, 99, 99.
And we'll do it on the back.
99, 99, 99, 99, 99, 99, 99, 99.
One more time. Thank you. I felt the same normal sound in all the areas, okay? And next I'm going to tap my finger on your rib cage to feel for the same sound that we were feeling earlier, okay? Very good. I felt a dull resonance in all of the areas, which is normal. Okay, and next I'm going to listen to your breath sounds. If you would just take a deep breath each time I move my stethoscope.
Okay.
Thank you. I heard clear in all the front. We'll do that on the back now. Couple more times. you very much. I heard a clear, your lungs are clear in all the areas, okay? And now one last thing, I'm going to have you say 99 when I listen on your back, alright?
99. 99. 99.
Alright. It was a dull, muffled non-sleep sound, which is normal. Okay, now we're going to go, I'm going to feel your carotid pulse on your neck. Alrighty? And you just go ahead and look forward. We have a normal upstroke. The rate and rhythm is good. And I'm going to go ahead and listen. I'm going to put my stethoscope lightly on your neck. Okay, I heard normal sounds. And now I'm actually going to have you lay back, and we're going to look at your, you can lay back from there and have your feet hang off.
Okay.
Alright. Might have to move the pillow. Sorry, I thought that we might need it. There. I'm going to have you look that way, and I'm going to examine your jugular vein. There's no abnormal pulsations. It looks good. And now I'm going to have you stay there, and we'll measure the angle. It's less than 3 centimeters, which is normal. And now, if you don't mind, I'm going to place my hand at the apex of your heart, which is right underneath the breast tissue, okay? I felt a soft, normal patter of your heart. And now I'm going to listen to your heart as well. There's normal love-dub sound, which is what we call S1 and S2. The rate and rhythm is normal as well. Alright. And I'm actually going to have you sit up again. And I'll listen to your heart one more time, listening for any murmurs. I'm going to have you exhale real big. Okay, no murmurs heard, which is normal. Alright, now we'll go on to I'm going to inspect your arms and legs and your vascular system. So let me see your arms. And turn over. They're normal in color. The warmth is the same throughout. Good. Capillary refill is less than 3 seconds. Now, I'm going to feel your pulses. The radial, the brachial. They're normal bilaterally with a good rate and rhythm. Now I'm going to feel for your lymph nodes and your elbow. You can bend it slightly. It's not often we feel them, which is normal. Now the other hand, bend slightly. And now, oh, that's okay. Do you need a tissue? Here. There you go. Alrighty. Now I'm gonna.
I need some hand sanitizer.
Oh, sure.
Don't want to get you sick.
That's very considerate. when you're done with that, I'm going to look at your hands and test your. So what I'm doing here is I'm holding each of your arteries. I'm going to have you make a fist a couple times. Yep, keep going. Okay, now keep it open. And you see how the color returns within 3 seconds. That's normal. We'll do the same thing over here. Close it, open and close the fist for me. Good. Okay, and now open. And the color returns within 3 seconds and you have good capillary refill. Okay, now I'm going to inspect your legs. I'm actually going to have you lay back for this. Again. Good. And if you don't mind, we'll scoot back a little bit. Like, my feet are here? Yeah, your feet just at the edge here. Do you ever have any numbness and tingling in your legs? They're normal, warmth and color. There's no edema noted on the shin area. I'm going to feel your pulses. Dorsalis pedis. Popliteal. They're all what we call +2, which is normal. I'm going to have you bend this leg. I want you to tell me if you have any tenderness in your calf. Any tenderness?
I'm sorry.
No, I don't. Okay. And now the other one. Any tenderness over here?
All clear.
Alright. Now, if you don't mind, I'm going to feel your lymph nodes in your groin area and your artery, okay? I don't feel the lymph nodes, which is normal, and the artery has a good pulsation, and no lymph nodes over there, or can't feel the lymph nodes there. Alright, now, this may seem weird, but I'm going to have you lift your legs up, and we'll hold them up for 30 seconds, and then I'm going to have you sit on the side of the bed, and we'll see with your legs dangling over the edge, okay? Alright, now let's scooch to the edge and sit over there. Alright, it looks like the color returned within 15 seconds. Alrighty, and I'm gonna check your strength. I want you to push against my hands. Good, and pull against my hands, in towards you. Good. And then last thing, I'm going to have you stand up and face the exam table. There's no evidence of any varicose veins, but I'm going to test and see. There's no wave felt on the left, and no wave felt on the right. Very good. I'm going to have you sit down one more time, and we're just going to talk about, do you do self-breast exams every month?
I guess you could say that.
Okay. The best time they say is right before or right after your period, because your breasts are the smallest and you have the best feeling there.
When are your breasts the biggest?
Well, maybe before your period.
Alright.
So what you'll want to do is you'll want to go, there's 3 different techniques. You can go out like a starburst, like that, and feel. Or you can do in a circle starting at the areola all the way around, okay? Or you can do up and down like this, okay? And you'll want to make sure to get, to raise your hand like here and get up in the armpit because you have all your important lymph nodes up here, okay?
What exactly am I feeling for?
You're feeling for any lumps, tenderness, anything abnormal. And that's why they recommend to do it monthly so that you know what the normal is if you feel anything that you might not recognize. Okay? any other questions for today?
No, I do not.
Okay. Well, I'll see you next time, Abby.
Alright, thank
All right?
you.